Welcome to Nursing Informatics. We will talk about key points and essentials with respect to nursing informatics and technology. At the end of this session, you will be able to describe how selected theories and models assist in explaining and predicting the relevance of healthcare informatics in patient care and improved outcomes. We will discuss the relationship of one theory related to nursing informatics and improved patient outcomes in healthcare delivery, and describe the evolution of nursing and the healthcare informatics in the U.S. healthcare delivery system. Whether we like it or not, computers and the internet are certainly here to stay. That is apparent everywhere where we look in our clinical practice settings. Certainly, computers and the internet have changed the way we communicate, obtain information, the way we work, and also the way we make important health decisions, both as a healthcare provider and a healthcare consumer. As documented in the Pew Report, April of 2006, some 21 million Americans rely on the internet in a crucial or important way for career training. 17 million rely on it when helping someone else with a major illness or healthcare condition. Yet another 17 million rely on it when choosing a school for themselves or for their child. Computers and the internet are certainly changing healthcare delivery too. All we have to do is look at the clinical practice setting on a daily basis, and we can see, for example, how we have to network with others to exchange patient records, depend on others for healthcare info such as lab or x-ray, or previous information from a medical record. We also see there are reminders to our patients to improve their adherence to clinical practice guidelines, including immunizations, healthcare follow-up, and other health important information. An integrated electronic healthcare record and reminder system also helps in the care of certain diseases. For example, care of the diabetic patient who has many healthcare needs, or patients who suffer from coronary artery disease. Another study we need to look at relates to the computer-generated reminders for patients, especially in areas where patients may have a lack of a certain healthcare need. We can rely on that to be certain our care is timely and relevant and follows clinical practice guidelines. It is evident that infrastructures are improving the efficiency, quality, and safety of healthcare through the interconnections with healthcare informatics and technology in broad ways. Some of the important pieces we are talking about about healthcare informatics and nursing are related to theories and models that help us explain ways of dealing with healthcare information technology. Concepts are parts of theories and models, and they help us see what the linkages are and the relationships formed in theories and models. Certainly, the basis of all theories reviewed will be the systems theory. We know that nurses are not immune to the changes that computers and informatics are bringing into everyday life of nursing practice. Looking at healthcare informatics and nursing information technology from a systems perspective or theoretical perspective help us achieve the goal to interrelate concepts related to quality patient-centered care. We are focused now on increasing not only patient outcomes and patient safety, but we can also be concerned about a healthcare provider satisfaction and the ability to get information in a prompt, timely, accurate, and safe manner. Whether or not we are working with nursing students or learning a clinical procedure, using computer-based technology or informatics, nurses are constantly using theories and models in healthcare informatics, whether they know it or not. If you think about nurses using technology, including intravenous pumps to safely administer medication, using a database to plan a budget, or working and keeping updated in the latest evidence in nursing practice, it is readily apparent that information technology does consist of interrelated components and concepts, and these are part of the nursing practice at the institution and individual level. The basis we will focus on is systems theory. In terms of reflection, two important questions we need to ask ourselves with relation to informatics and nursing are, have you thought about the importance of a theory or model in relation to healthcare informatics before today? How does a theory or model assist in automation and use of technology and providing an effective and efficient means to manage large volumes of data and information? In this day and age, almost everyone is involved with computers to some degree. Some have chosen to specialize in the field of computer technology, and we are seeing more and more nurses applying for positions in information technology. Just over a decade ago, the term nursing informatics might have caused nurses to have a puzzled look, or others might ask you, what is it that you do? Since then, we are seeing nursing informatics as a more relevant and essential element of healthcare delivery, certainly for managing large volumes of data and patient information. In the last few years, there has been substantial increase in demand for nurses whose knowledge of nursing and specialization in healthcare informatics or nursing informatics contribute to nursing practice. These nurses are called on frequently to carry out valuable contributions in nursing leadership, nursing education, with research and healthcare delivery, and also in the educational setting. When we think about it, the internet has really assisted us with linking healthcare professionals to large amounts of data in short periods of time. There are specialized interest groups focusing on nursing informatics and healthcare, and these specialization groups help us look at nursing informatics as the integration of nursing information, information management, information processing, and communication technology supporting the health of people worldwide. The internet has really facilitated our knowledge and understanding of these important links, helping us as nurses with large amounts of data, again, in a very short period of time. The internet has also helped us increase our accuracy, timeliness, and putting together key pieces of data that helps us provide safer patient care. Statistically, some of the pieces that nursing informatics helps us do is foster collaboration among nurses and others who are interested in improving patient care and quality through nursing informatics. The other thing we can do with nursing and the internet is to explore the scope of nursing informatics and look at its implications for information handling. For example, how do we handle those large data sets associated with nursing care delivery, nursing administration, nursing research, and other healthcare information systems, plus the relationships among them? Nursing informatics and the internet facilitates nursing and patient care knowledge. It provides support for understanding dissemination of important information in nursing and helping us collaborate with others so our care is timely and relevant. It also helps us develop recommendations and guidelines as well as courses in nursing informatics to improve upon and do this work better. The internet provides access to data and global information and facilitates development of our knowledge in so many ways. Nursing informatics is the ability of nurses to carry out their duties in relation to any function of nursing, but also using computer science, information science, and nursing that is designed to assist in the management and processing of nursing data and support the nursing practice and delivery of care. With respect to application of theoretical knowledge, it helps us to plan future approaches and solve current problems in healthcare informatics. Specifically, we might look at an application of theoretical knowledge from a systems perspective, such as computerized provider order entry, or CPOE, which is common in many healthcare organizations today. This has been a major thrust in acute care and long-term care settings, specifically to increase patient safety with provider handwriting challenges. For those of us that have been in nursing for some time, we now realize that CPOE eliminates the provider handwriting issues and increases patient safety. Electronic health records and e-health is another area that is emerging in the intersection of medical informatics, public health, and business, as well as in referring to health services delivered or enhanced through the internet or technology. In a broader sense, the term e-health and telehealth are used somewhat interchangeably, but are different. These are a new way of thinking in new theoretical areas that indicate a commitment for network global thinking and to improve healthcare locally, regionally, and worldwide by using information and computer communication technology. When we examine how change impacts healthcare delivery and systems, we want to be in a leadership role, and we don't want to be afraid of change. There is a need for nursing informatics and healthcare technology. In 2006, fewer than 10% of hospitals had implemented healthcare information technology. About 16% currently used an electronic health record. The vast majority of healthcare transactions in the United States still do take place on paper medical records, paper charts, or systems that had essentially remained unchanged since the 1950s. The healthcare industry spends approximately 2% gross revenues on technology, which is minuscule when you think about this meager amount compared to other information-intensive industries such as finance, which typically spends 10% per year. The development of standards for electronic health records is another national agenda item, and we have to be able to access healthcare records once they are developed. Therefore, we need to look at challenges to accessibility. There are still a lot of issues with interlinkages and healthcare records being interchangeable outside of individual healthcare systems. Thus, we need to increase our ability to communicate between and among healthcare systems. We don't want to be afraid of change, and we know that healthcare information and technology is impacting healthcare delivery. As you have read this week, there are many theories and models. One of the more popular models is Bloom's model of information. One thing we need to be aware of is the application of Bloom's model of information to explain how computers are used or may be used in the future to support healthcare delivery. This is very important because, as you know, nurses often work with other nurses as well as other healthcare systems personnel to develop health information systems that are user-friendly and also advance knowledge from the components of the system. Bloom developed a definition of information from an analysis of the accomplishments in medical computing. In his analysis, Bloom identified 3 types of healthcare computing applications. He then grouped these applications according to the objects they processed: data, information, or knowledge. Bloom defined data as uninterpreted elements such as a person's name, weight, or age. Information was defined as a collection of data that has been processed and then displayed as information. An example is the patient's medical record. Knowledge then results when data and information are identified, and the relationship between the data and information are then formalized. A knowledge base is more than the sum of the data and information pieces, according to Bloom. Bloom hypothesizes that a knowledge base includes interrelationships between the data and information. For example, Bloom would view a textbook as knowledge. Shannon and Weaver's model of information is used to describe an application in teaching nurses about healthcare information. Information theory is a formal theory born in 1948 by a classic publication which was then landmarked by Claude Shannon. This landmark paper was titled A Mathematical Theory of Communication. The concepts in this model included certain concepts and components. For example, the information communication model developed by Shannon and Weaver is that there is a sender. The sender is the originator of the message. There is an encoder that converts the content of the message to a code, and this code could be letters, words, symbols, and music, for example, or a computer code. The modem on a computer acts as an encoder when it converts a file from a digital form to an analog form, so it can be sent over a telephone line that carries this analog sound wave. The telephone wire would be the channel. The channel is the component that carries the message. For example, sound waves, paper, and telephone lines. Each channel has its own physical limitations in terms of size of the message it can carry. Another component in the Shannon-Weaver model of information is noise. This happens often in healthcare delivery. Noise is anything that is not part of the message, but occupies space on the channel and is transmitted by the message. For example, as a nurse trying to communicate with a physician or other nurse and someone interrupts, that would be noise. Another example is static on a telephone line or background sound in a room. The decoder converts the message to a format that can then be understood to the receiver. For example, when one is listening to a phone call, the telephone is the decoder. It converts the analog signal back to sound waves which are understood as words by the person listening. The person listening to the word is the receiver. The Shannon and Weaver model of information would be very helpful in helping other nurses learn about healthcare informatics and to learn about the complexity and challenges facing the person who is trying to educate someone else about information technology or to learn, for example, a new computer system. We just spoke briefly about the definitions about healthcare informatics in Bloom's model. Looking at the concepts related to healthcare informatics, we look at data as information in a raw or unorganized form, so again, such as alphabets, numbers, or symbols, that refer to or represent conditions, ideas, or objects such as a person's name, weight, or age. You may think of many other great examples. Information is a collection of data that has been processed and then displayed as information, for example, a medical record. Knowledge results when data and information are identified and the relationships between data and information are then formalized. Remember that knowledge base is more than the sum of the data and pieces. Wisdom is viewed as knowing the concepts of data, information, and knowledge to explain the concept and study of nursing informatics. Wisdom demonstrates the appropriate use of knowledge in managing or solving human problems. It is knowing how and when to use knowledge to manage a patient's need or problems. Wisdom requires a combination of nursing values, experience, and the 4 types of knowledge previously discussed. Examples and applications of the 4 types of learning theories that explain how people learn are behavioral learning theory and those theories which were developed around the turn of the 20th century, and they focus on the smallest units of learning. In this theory, the basic unit of learning is conceptualized as a stimulus response unit, or SRU. The stimulus is the input to the system or learner. The response is the output, or the behavior that is then exhibited by the learner. Behavioral learning theories provides 2 key concepts that can be used in informatics to explain learning. These are pairing and reinforcement. Information processing and cognitive learning theories divide learning into 4 types. How the learner takes input into the system. Number 2, how the input is processed. Number 3, what type of learned behaviors are exhibited as output. And 4, how feedback to the system is used to change or correct behavior. Input of information is a very complicated and challenging process. These concepts are important to you as you are learning about healthcare informatics delivery, or you are working with patient populations and explaining these concepts to others. Cognitive learning theories are those theories which allow us to focus on knowledge and information that helps learners build interpretive cognitive structures as they learn about new information and import data. Learners who are hearing new information and taking notes at the same time may have difficulty capturing the content they are trying to record. This often happens in cases nurses learning about nursing informatics or trying to teach others, or for example, as they are trying to teach patients. They need more time to interpret and structure data, and the slower the learner will be able to import the data. The nurse plays a vital role in helping understand how patients learn, how they assess the learner's previous knowledge, and how they identify potential problems. Relating new information to a previous learned information will help learners develop interpretive structures, and in turn, they will be able to learn the info more quickly. Adult learning theories focuses on the unique learning characteristics of adults. There is a term, andragony, which is the art and science of helping adults learn. Knowles' model proposes that adults share a number of similar learned characteristics, and that these characteristics can be used in planning adult education programs. There are a number of characteristics that must be taken into consideration as we plan adult learning, and this is true for helping nurses learn about computers and informatics, but also helping our patient populations understand this as well. In terms of historical integration of education programs in healthcare informatics, keep in mind that it was not until the mid-1960s that medical informatics became integrated into the university curriculum to be studied as a science. The first university that integrated medical informatics education were located in France, Holland, Belgium, and the Union of Soviet Socialist Republics, the USSR, now known as Russia. As healthcare relies more and more on informatics and information technology, it is imperative that healthcare delivery include basic computer skills and nursing informatics competencies, and that we incorporate these into all levels of professional nursing education programs. This coming about is largely a result of knowing that nursing and healthcare providers recognize the importance of informatics and include specific content into the professional and formal education curricula. It was as recent as 1989 that the first master's program in nursing informatics was established at the University of Maryland, following the doctorate in 1992. Now there are numerous universities offering master's, doctorate, and postgraduate certificates in nursing informatics because this has become such a large and growing field. There are certainly many resources available and many educational programs available in terms of informal education in nursing informatics. There is not an option or a personal choice. Nurses aspire to learn more and become more knowledgeable about nursing informatics. There are both formal and informal educational opportunities in nursing informatics. Keep in mind that the first nursing informatics program started within the last 20 years, and the number of programs has been steadily increasing ever since. In terms of healthcare technology, computers and technology grew out of the need to communicate, tabulate, and manage information. Changes in healthcare delivery, particularly related to managed care, resulted in the need to manage large databases, be able to access those databases, and look at trends and data of clinical system care maps and outcome measures in a timely and efficient manner. These shifts have resulted in the recognition of the need for computerization within the healthcare industry in terms of collecting, managing, analyzing, and reporting data that comes from a wide variety of resources and across many continuums of healthcare. These rapid advances in technology that have enabled the development of complex interfaces, communication and networking of very diverse systems in healthcare. We need workers to work with these systems to develop, refine, install, consult, and market these systems, as well as help others to learn about them. We know informatics quickly spread from the business and industry and the military into healthcare. The status of healthcare informatics is evolving as the components of informatics, computer science, information science, and the discipline of science continue to innovate. It is important and relevant to study the history of healthcare informatics, as this provides an opportunity to learn from the experience as well as give insight into progress and future perspectives. As mentioned earlier, we see much change in the development of healthcare systems and the way healthcare is delivered, particularly related to healthcare information systems, whether that be a hospital, clinic, primary care provider's office, or now in the patient's home. We have many capabilities for technology ranging from advanced instruments to higher level decision support and more clinical information systems, e-health technology, as well as other advanced technology.